was in a large seclusion room in an old state hospital in Washington State, and had been in the seclusion room for a long period of time, at least 3 or 4 days. Was heavily medicated and sort of just lying on the floor. I can remember there were heavy bars on the window, almost prison-like bars, and kind of a window that was high up on the wall where you couldn't really look out very far. And I heard fire bells ringing as if there was a drill or something like that, or in my mind, I thought there was actually a fire in this hospital. And could hear outside the seclusion room door people sort of hustling out, and it scared me. I thought there was a fire in the hospital, and I thought I was going to burn. I pounded on the door. It was a thick metal door, and I pounded with my fists over and over again, screaming and yelling, "Let me out, let me out." And I'm burning, and why won't you let me out? And at that point, I just thought I was there to burn, that I was either being punished or that I was going to be forgotten about. What I was thinking was that I was forgotten. I was in the back wards, only in the back seclusion room, if you will. Later, years later, did I find out that it was a fire drill. And my heart just sunk, that fire drill or not, that I would be left there to think it was a fire. That no one would think to come in and say, "We're having a fire drill, we need to leave you in here." Any consideration at all. I mean, it mentally ripped me up for a long time.
Mama, oh Mama, I heard my baby cry. Don't want to stay here.
I had been in mental hospitals, several mental hospitals from the time I was 13 till I was 16. I was told when I was 16 that I would be there for another 2 years, and then maybe they would release me, but more likely they would send me back to the state hospital. I decided those weren't very good odds and had the opportunity to escape, which is what I did. The reason why I got involved with the mental patients self-help movement was for a number of reasons, one of which because I was very angry. I had an incredible sense of outrage at the fact that I was treated so badly for those 3 years, the fact that my adolescence had been virtually taken away from me.
They stripped her almost naked, her hands and feet they tied. They pumped her body full of drugs. How my angel cried.
2 aides, they took me into what was called in hospital, this jargon of Rockland State Hospital, was called a section. It was this big bathroom. And they told me to take off all my clothes. And they said, "We have to take your clothes to be labeled." And because had been in this private hospital, I had name tapes in all my clothes. And I said, "Well, I already have name tapes in all my clothes." And they said, "No, we have to take your clothes off to be labeled." And I didn't get them back for a couple of weeks. And when I got them back, they had written my name in marking pen on all my clothes, so they were all ruined, even though they wrote it right next to the name tapes. And all my clothes were ruined.
The Lord, he had his crown of thorns. He must have felt the pain when the force of those electric bolts tore my baby's brain.
What happened to me was I was locked up by the psychiatric system. They said my state of mind was an illness, that I was diseased, that I would be sick forever, that I had to take these drugs that made me feel bad. They gave me shock treatment, left me broken.
I trusted in the doctor, I trusted in the nurse. They said if they didn't have their way, things would get much worse.
So they put me in a room, an isolation room, and they strapped me down in 4-point restraints. And there was just, I don't know if you ever done that. It's like you can't even scratch yourself if you itch. Eventually, you know, you're trying to hold back from going to the bathroom, and you end up going to the bathroom, you know. Now, they drugged me, so there was times when I wasn't even conscious, but there would be stretches. I'd be awake for like 2 or 3 hours at a time, and it was just pure hell.
But how can things be worse than this? It's for her good, they said. What kind of comfort is that for me?
My family thought that they were paying for the best. He used the kinds of treatments that were years ago of beating the psychosis out of you. I always felt deep inside of me there was somebody they didn't know who they were doing this to, that I would get back, that they'd hear from me, that someday they would hear from me. I couldn't do it now. My mind was too confused. I was imprisoned, you know, I was locked up, but I would be back.
In August 1988, some 800 ex-psychiatric patients from across the nation, representing thousands more, convened at the University of Utah.
I don't know, I guess they get caught up in the stereotype that we can't think, you know, we can't be intelligent because we're mental patients.
They are the new committed to ending the indignities and humiliation suffered in the name of psychiatric treatment.
You ought to have some system of care which is coming from the client's, the consumer's perspective, that they are a partnership in that treatment, and that it be humane and it be real.
As part of a swelling national self-help movement, they have chosen to become the final arbiters of their own destinies.
We gotta fight back. I think you'll agree. It can happen to you, it can happen to me. We gotta fight back. I think you'll agree. We gotta break the chains of psychiatry.
They are committed to creating alternative programs which meet their own needs as they define them. Complete and accurate information, strong advocacy, and loving support. Our film will take you there.
37% of the people that we see have no income, 43% of the people that we see have no shelter. Through our services, they find shelter, we established an income for them, and we have a place for them to be during the day where they're accepted and welcomed. If they didn't have that place, if the center closed down, most of these people would be in jail, would be in mental hospitals, would be dead.
Constantly, it's people saying, I don't know what I'd be doing if I wasn't here. I don't know what I'd do if it wasn't for this place. This place has made this tremendous difference in my life.
Yes, our Alliance has a peer advocacy service, and we provide a link for people that are locked up in institutions with the outside.
When I think of what would happen, the biggest thing I think of is all the homeless people, the people who are homeless, who are experiencing emotional distress, would have nowhere to go, because the only place they'll go to is programs like ours. They will not go any other place. They are, to me, living proof that the system isn't working, that the mental health system isn't working. They won't go near it. They would if they had the choice, and sometimes it is. A board and care home, a halfway house, or the streets. They're picking the streets.
It can happen